So in the last video, what we talked about was cholesterol, what it does in the body, and really how important it is, and by reducing it with a pill, you can cause a lot of damage. What I want to talk about in this video is all about, number one, what's causing this inflammation in these coronary arteries, and number two, the actual new paradigm about what a heart attack actually is. So let's start here. What's causing all this damage is this. Sugar inside the body. So your body is either burning sugar or it's burning fat for energy. Here's the thing. When you burn sugar for energy, you actually create 50 times more free radicals. What free radicals do is they actually go to the cell membrane and they cause oxidation. It's kind of like rusting on a metal surface, okay? So just picture some rust happening. That's what happens to all the cells of your body. So what we do is today we bombard our body with sugar in the form of high fructose corn syrup, sucrose. Well, those things are which is table sugar, they're so toxic to your body. Your body can't really process them naturally. What ends up happening is all of these free radicals go to all the cells of your body, start to destroy the membranes, and then your body sends out inflammation, okay? Now, inflammation gets a bad rap today, but it's actually the healing process of the body. Inflammation is necessary to heal. So, if you have chronic inflammation, the inflammation is not the problem. It's what you're doing that causes harm to the body, which, in the case of diet, it's this. This is rampant in our society today. So, what ends up happening is this. We eat this sugar, your body creates free radicals, it goes to the cells inside the arteries, the body creates cholesterol, sends it out to create new cells and to heal, and some of that cholesterol gets stuck inside and it starts to create the scar tissue, which we call plaque. So, really the issue is this. Instead of reducing the cholesterol by taking a pill, why don't we reduce the sugar intake? What that does, and it's been proven time and time again, switching to high-fat, high-protein diets, or even you can have sugar with fruit because fruit comes with the antidote, which is the fiber and all the nutrients inside. Eating fruits, vegetables, proteins, a diet like a paleo diet has been proven time and time again to stop and actually reduce and reverse some of that. Now here's the real issue. This is the old paradigm. The old paradigm says that clogged artery stops blood flow to the heart tissue. Heart tissue doesn't get oxygen, starts to die. When the tissue dies, it can't beat anymore. And that's what causes a heart attack. That's what causes death in a human. Now, here's the interesting part. They've actually done studies on a dog. This is a medical doctor in Germany, took a dog, tied off all the coronary arteries completely. Guess what happened to the dog? The dog got up and lived and was still healthy afterwards. So, what they found was this. Your body is so smart that when one of these coronary arteries starts to get clogged and constricted, your body starts to create new blood vessels to heal about. It's called collateral blood vessels. So, what they've done on these people who've died of heart attack is they studied the blood flow of people with heart attacks, and they found that people who have heart attacks, their blood flow doesn't stop. So what this means is our whole way of looking at heart disease is not proper. What we know is this. The cells of the heart aren't getting oxygen, or there's no oxygen for them to use, so there's no energy it can create, and the cells die. That's what we know for a fact. Now here's the interesting part. The new paradigm that's coming out, and this makes the most sense, it's what I see a lot in my office, is this. It has nothing to do with clogged arteries, it has everything to do with your central nervous system. So, what happens when you get startled or you get scared is something kicks in. It's called your fight or flight system, or your sympathetic nervous system. Sympathetic nervous system. That's what happens when the adrenaline starts to flow and you feel like you need to run away or you need to fight, okay? What happens to your heart, everyone knows when you get scared, is your heart speeds up. It beats faster. How that happens is this. you have a bundle of nerves that come off right here, the base of your neck. And these nerves, right about here, come off, and they go to the heart, and they tell the heart to speed up. Okay, makes sense, right? Well, we also have a system called the parasympathetic. Parasympathetic, which is literally the rest and digest part of your nervous system. So, these work in opposite of each other, meaning after the threat is gone, the brain sends out a signal to this very important nerve called your vagus nerve. Let me write that out. Vagus nerve. And that vagus nerve comes right outside of here. It's called your brainstem. And that vagus nerve comes out, and it goes to the heart, and that's what tells the heart, okay, slow down, slow down. What's happened with people with heart disease? Every time they've done a study on this, they found this. People with heart disease, they see something, their heart speeds up, and then, for some reason, this vagus nerve can't shut it off. The vagus nerve doesn't work, and there's no parasympathetic activity to the heart, meaning this, the heart can't slow down. And because it beats fast for so often, it uses up all of the oxygen, and then all of a sudden it's got no more oxygen to use, so the heart tissue dies. That's what causes a heart attack. So really, if you want to prevent heart disease, it's very important to do one thing. Make sure your parasympathetic nervous system is working at 100%. So some things that help your parasympathetic nervous system, number one, meditation, getting quiet time. Number two, exercise. Exercise releases growth hormone, which inhibits cortisol, which is a sympathetic nervous system. And number three, which is the most important one in my view, is what I see all day in my practice, is this part of your body, in your vagus nerve, comes out of your upper neck. And you have a bone called your atlas vertebra. It's the top bone in your neck. What it does is it actually protects this vagus nerve. It protects your brainstem. But when you have a car accident, a lot of times kids are born this way. They pull and twist on the head. What happens is it actually misaligns that top bone in that neck. And what it can do is actually start to put pressure on the cranial nerve or that vagus nerve. And the vagus nerve, instead of working at 100%, starts to shut off and slow down over time. So I get a lot of people who come to my office, and we actually measure the nervous system. We'll see the sympathetic nerves on fire, firing like crazy, and we'll see this part of the body having a huge misalignment and that vagus nerve starting to shut down. So they believe now, and the medical doctors are actually confirming this, this is what's causing heart disease. So if you want to have a healthy heart, you need to have a healthy nervous system. That's the most important part. So make sure, number one, this top bone of your neck is lined up. Go to a really good chiropractor, somebody who doesn't twist the neck and pop it, somebody who doesn't over-adjust you, somebody who takes very good films and measures your nervous system. Those are people who are taking their job very seriously and do a very good job taking care of this scientifically. Number two, make sure you take time for yourself, at least some quiet time to meditate, to pray, take your time just to relax. And then number three, you got to get some exercise. That growth hormone is so important for stopping cortisol and stopping that sympathetic nervous system from kicking in, okay?